What's up, y'all? It is LTJ Reads, and this is Throwing Light. And if you're not throwing light, you're not acting right. Tonight, I've got a dear friend here in Austin with me that I'm going to be interviewing. This is just one of those people you run into, and you get excited. I don't understand how much I like him until I see him. I'm like, man, I wish I saw you every day. I wish I could see you every day. And that is Ben Walker over here in Austin, Texas, with me. Ben, how are you doing?
Doing great. Happy to be here.
Good. Here, we're in the same city, so even though it looks like I'm in the universe, if you see,
You're floating around
I,
in space.
I pretend that I'm in space a lot. Yeah, that I'm much bigger than this planet. Yeah. Some of this planet, I believe some of the decisions made on this planet are below me, and I don't understand why I'm here on Earth. I pray for Jesus to come down and end it all the time. Just come down and end it. End it.
Those are
So,
very.
Ben,
I know you like to read, so I brought all my favorite books here too.
good. Okay, cool. Awesome. So, Ben, why don't you tell everyone a little about yourself, how you got involved in the community, why you're here, what you do.
Sure. So my involvement, I'd say community is a big word. But my first introduction to the kind of what I call our community is through sexual health care services, through AIDS service organizations. My first job out of grad school was at AIDS Services of Austin, which was at the time our primary AIDS ASO, AIDS Services Organization in Austin, Texas. In that role, I managed our HIV health insurance program. So if you're living with HIV, in most states, there will be a program called related to your ADAP or AIDS Drug Assistance Program that can help you pay for health insurance. A lot of people don't know that. It's important to know what kind of resources are out there. And it was my job for about 3 years to be able to connect people with that health insurance. This was pre-ACA too. So people that lost their health insurance and wouldn't be able to get back on health insurance if they had a pre-existing condition, which HIV was certainly considered. So getting people on insurance, keeping their health insurance was super important. And it still is. But from that role, I was helping people get HIV drugs. I was also the first person that got called when PrEP started becoming a thing. This is 2012 it got approved. It wasn't until 2014, 2015, until people here in Texas, our public health here in Texas runs a little bit behind other parts of the country and other parts of the world. People started about hearing about PrEP. So I got a lot of calls how people could access PrEP. And we were actually told at our organization that we weren't allowed to work with people that wanted PrEP because there were some ideas early on that it was going to influence people to make less healthy decisions. There's a lot of paternalism in the system, and especially in sexual health. Oh, if you give people access to, say, condoms, we're actually not allowed to bring condoms to certain schools because they think that's going to encourage people to do more dangerous behaviors or risky behaviors. So those ideas. But we actually, at that time, around 2015, we had a group of volunteers that I helped lead that created the first PrEP clinic here in Austin. So the first PrEP clinics in the state, the first standalone PrEP clinic in the state of Texas. That was called Austin PrEP Access Project. So I started that in 2015. And that eventually rolled into what's called the kink clinic in Austin here. And it's also in San Antonio and Dallas. Was the executive director there for 2 years before leaving that and then starting another program called the Center for Health Empowerment, which was another PrEP clinic based in East Austin with the goal to provide HIV prevention medication PrEP to communities of color because we were seeing a lot of white cisgender men, gay men with health insurance that were going to the first clinic because, well, anytime you provide a resource that is not existing enough and you provide it for free, people that have the resources to get that other resource faster are the ones that are going to pick it up first. And then there's not enough of that to go around sometimes. So we started Center for Health Empowerment. I was there for a year before moving on to Asheville. Asheville at that time was their House Wellness Center and an organization, another AIDS services organization that had been around since the 80s, but was struggling for funding. And we started up a clinic there, HIV prevention clinic, HIV clinic, and started doing Hep C and gender care as well there. And I was at Asheville for 7 years. helped start up that clinic there, and that's where we are today. So my first integration into the overall queer community was through queer sexual health and PrEP services and HIV services. And then from there, kind of meeting other communities like the Austin Gears. There's a group called uh, Gulp around for a while, and just seeing other groups that had kind of created a more sex positive landscape. And this is a place where people could go and be more open and honest and communicative and enjoying sex and sexuality for queer people. And that was kind of my intro to leather and BDSM scene. On that front, I'm more have a background in leather and kink through a lot of pup play, which I've done for on both pup and handler side for about 6, 7 years. I got to be a judge for Kink Weekend on for the pups and handlers for the second Kink Weekend, which was a lot of fun.
I remember that.
Uh, yeah, and then just exploring leather and having fun. Um, exploring and just there's a whole lot just under the leather banner too. We can talk about any part of that too.
So, that's great. I do want to, we can talk about how, and even it's so interesting. I had Dr. Ty Leatherman on last week, and we talked about how your career can sometimes coincide or coexist with your leather community thing, or so I think that's really cool. I have a couple of questions for you. So, that's cool about prep. That's really fascinating. Because we're in 2024. I'm just going to ask you a direct question. It's a fear that I would just like to discuss right now. Do you think with the new administration coming that the access to things like prep will be restricted?
Certainly a fear. Things are going to get harder overall for public health. I expect, of course, I don't have a crystal ball. Nobody has a crystal ball. But things like the ending the epidemic campaign that we're seeing more and more funding go towards PrEP and HIV prevention and sexual health. And now what we're hearing now is that to expect a lot of cuts in the federal government. So that plus we're hearing that there's a desire to privatize more and more things, privatize more and more health insurance, possibly move away from expanded ACA to maybe a more private system plus ACA, which is already private but subsidized. So I'm not expecting like a direct cut, like, hey, you know what, we're going to not allow PrEP as part of these programs. But I think it's going to get harder, and some of the resources that we're expanding are going to contract.
Okay. So, I mean, that's just the reality that we need to think about that, some of these services that we have might be could be impacted. But the hope is that we'll be able to adjust, correct?
Yeah, yeah. Well, public health in Texas has always been about, at least my experience has been how do we expect what could happen and how do we pivot when it does. So have working in nonprofits, making sure that you have different lines of funding, making sure that you're aware of what might happen, what resources are out there. Because the last thing I want to do is start a resource or a line of service at a clinic that I'm working at that the next year I can't offer because people rely on that, especially when it's medical care. So making sure that we have consistent funding, that we can consistently offer any kind of medical care that we've started people on is hugely important.
So, you said that Texas is a little bit behind. Can you give us a picture, though? What does ahead look like? What state might that you know of, if you know any state, that's ahead of the game?
Yeah, but a number of states. Washington State does a great job. Colorado has great public health. New York has great public health. But let's take Washington first. One example is what's called a PrEP app. Most states will have an ADAP, an AIDS Drug Assistance Program. So if somebody's uninsured and living with HIV, that is a way that that person can get free HIV medication and treatment, at least medication. Most states don't have that for PrEP. So if someone wants PrEP and they're uninsured, there's no safety net for them getting PrEP through the public system. Washington has what's called a PrEP app. So if someone is uninsured and wants PrEP, because it's obviously in everyone and the government's best interest for anyone that wants PrEP to get PrEP, both financially and public health wise. With a PrEP app like they have in Washington, anybody can get PrEP for free through a public program. In addition to someone living with HIV getting HIV drugs for free through a public program.
Washington's a beautiful state. I actually went there for my birthday in October. I went to Seattle. I love Washington. And the thing is, I don't like the weather, but like you go, and it's just such a beautiful state to me. I just think it's so beautiful. So it's actually been, if I left Austin, I've been like low key, like, but it's expensive. But I mean, Austin's expensive too. So we know that. I find it interesting, you know, the fact that public health could be so different across the country and things and access to resources. Um that's interesting. Do you ever like I guess my question is, let's hypothetically say a federal government came along and they wanted to just wave the wand across the nation and be like, you know what, we're going to make PrEP this accessible across the country. How much access do we need as a community or as a population? Why is it important to have access? More or less, the question is, what's enough access, and why is it important to have access?
Sure. I think great example for Austin, particularly, is in Austin, there was no decrease in HIV rates since the 90s. There's decreased rates when protease inhibitors were and effective HIV drugs went to the market because we saw treatment, and we know treatment also equals prevention. But there was no decrease in actual rates since then. So it went up, it went down, and then it was basically plateaued. Well, in 2015, 2016, when we started a free PrEP clinic, people uninsured could get PrEP, people insured could get PrEP. We saw the first decrease in HIV rates since the 90s. So it's important because we know that this works. We have almost 10 years of data now, well, actually, even more with research studies before FDA approval. But we know PrEP works, and we're actually getting more and more different types of PrEP. We'll have injectable PrEP. We'll have injectable plus pill based. So we know this works. We know we can prevent HIV now in many different ways. Condoms also still are effective. It's just an access issue. This country has one of the biggest differences in healthcare based on income in the world. So people that have wealth in the United States have some of the best healthcare in the world. People that don't have wealth have sometimes no healthcare, depending on where they live. So it's just a big difference in access. But we know with the resources that we have, the drugs that we have, that we could, and effectively end new diagnoses of this. So yeah, it's frustrating to know that we can do it. It's just the systems aren't in place to be able to make sure that people can get to it.
So you're telling me right now your ability to obtain treatment is based on income, or so it sounds a little inhumane when I say it. Like, you get what I'm saying? We know that rich people can get great health care, and people that don't have anything have to fight to get some health care. And healthcare is very expensive in this country.
And B, this is when I get all socialist on you because I'm Canadian. So anytime you have a privatized system, people that have resources, people that have wealth, get great services, whether it be education or healthcare. People that don't have wealth get the opposite of that. Sometimes none of it. Very low education, low access to healthcare. When you have more public systems, it's an equalizing force. Look at Washington again. Well, Washington in general has great public transportation. Well, they invest in it. I lived in Houston for a long time. We did not have great public transportation.
Yeah.
Nobody with wealth would use the public transportation system. But when you say, hey, you know what, we're going to invest in this, it's going to be a resource for people that are wealthy and people that are not wealthy. Well, then the standard starts going up because everybody has to use something. So
Right.
when you talk about single payer healthcare system, okay, the standard goes up because everybody is using that system. when you stratify public systems and say, hey, you know what? Okay, we're going to have these different layers depending on how much wealth someone can expend, then yeah, we quickly get to a point where people with wealth have great service and people without wealth have the opposite of that.
That's just like I said, it sounds inhumane. It really doesn't sound good at all, just saying that. Um, and what's interesting, you brought up something, and I want to get into this, and obviously this impacts communities of color, right?
Absolutely.
So, what communities are affected the most of color, do you think?
With HIV specifically, or just
Yeah,
general
and,
health?
and, and also getting health care.
Yeah. Well, HIV, specific to HIV, we know Black MSM are disproportionately affected. Latinx MSM specifically, Black women.
MSM, what does MSM mean?
So MSM is public health terminology. It means men who have sex with men. So sometimes, like we will typically just say gay man, but people that are there are a lot of people that might have
Don't
uh,
identify as gay.
right, absolutely. So we use that terminology just to say, hey, you know what, this is men who have sex with men, whether or not you identify as anything in the LGBT plus LGBTQAI plus spectrum.
Yeah, it's just, man, that to know that we have the ability to decrease HIV rates by implementing these wonderful programs and medicines into play. Man, you just think that, you will want everybody to have this opportunity as easy as possible so that everyone, because sometimes people's lack of access to healthcare is what makes them poor. They can't afford to go to the doctor. And that makes them sick and they die of illnesses because they can't afford to go to the doctor. Because I'm pretty sure they've gotten to, even when you go to these emergency care clinics, if you can't put any money down, they will not see you. They will not see you. Like.
Totally. And it's also fear. Say someone has gone, they've had to go to the ER and they got stuck with a $10,000 bill. Well, they're not going to go back and try to get health care again. They think, well, obviously it's not for people like me. We don't have access to these kind of services. So just like you said, like, we're going to be afraid to access this kind of care. We're in debt because we tried to get health care in the past, or it happened to a family member of mine. And then we have insurance systems that are basically disincentivize people even using the healthcare when they have health insurance.
Yeah.
Yeah, no, we have a whole system set up I don't think a stronger word than disincentivize, but basically keep us away from getting the health we need to be healthy people and
Yeah.
communities.
How has this journey with sexual health and public health brought you and impacted you as a leather person in the community?
Yeah, that's a great question. Um, I've always I do this work in Texas, sexual health work in Texas, because you have to be creative to be able to do it here. Um, in other places that have great systems, it doesn't take the kind of creativity and finding loopholes to be able to create systems together. So there is I am attracted to working in Texas because of the unique challenges that we have as a southern state, as a conservative state in general. Um, that said, the closer I become to the leather community and the BDSM community, the more I fight to make sure that spaces are um, kink friendly, kink aware, BDSM competent. Um, I've always been very sex positive in my approach to healthcare and places that I've built, but it's more than that now. Like you can be sex positive, but I want at my clinics that I work at and the clinics that I administer, that if someone comes in and they want to talk about fisting, that provider uh, they don't go white. They're not surprised with what they're hearing, that they know exactly what fisting is, how they communicate about it, some great harm reduction to give that person, and to really thank that person for sharing something that they might have been intimidated to share with a medical provider for the first time. So yeah, for me, the goal now is to not just create affirming, um, sex positive programming, but programming that is actually kink aware and kink knowledgeable, so that when people come in and we say, hey, you know what, we're part of this community too, that we're actually giving out um, key advice specific to whatever fun sexual practices somebody's enjoying.
Do you have you in your job experiences have you shown up to work in leather or anything like that before?
I do. I actually have a number of. I have actually one I was going to wear today without epaulets. I have a leather button down without epaulets that I like to wear.
You own a lot of leather.
That's I. So shout out to Mr. Agilia and their Black Friday sale, because about half of my closet is their stuff from Black Friday, because that's what has made leather affordable for me.
So it's just once a year.
I stock up, man. I stock up once a
You
year.
were telling me about that though. No, I got to get on. I have to start working on my leather aesthetic. So I get it. Um, you've seen me in the community doing different things. And you saw me in terms of the leather community. You've been at a lot of leather events that I've seen you at and things like that. I'm gonna ask you this question. What are some ways, as people that are, leaders in the community, how can we bring more people to, the public health systems, to get like, what can I do outside of the clinic or the community to bring more people to these resources?
That's a really good question too. I think the more we openly talk about sexual health as something that we don't have to be intimidated about, it destigmatizes that conversation. It's just because I do it every day. It's there's really no stigma in it for me, in that I'll be at I'll be at a table at a restaurant and we'll be talking about syphilis, and it won't even dawn on me that the table next to us might not think that we're having a regular conversation. But I think that's great. I think the more we can talk to our friends, family, chosen family around us, say, hey, it's great. And I love when drag queens will be like, let's talk about testing, let's do testing. But I think we need to get past that. It's more than just testing. Testing is great. Talk to your friends about testing, destigmatize it, say, hey, I'm going to go tested this weekend, and encourage people to do that. But also say, hey, you know what? I talked to my medical provider about um, whatever fun I had last weekend, um, fisting, sounding, anything like that. And hey, I had a really good experience. Talk to the people that you know in your family or friends around you that are in the medical community, and encourage them to be more open about those conversations when they're talking to people that they work with. I remember going to my personal PCP. It was something like 10 years ago. But I could see that little questionnaire that he was going through, and he skipped the whole section on sexual health. I was a 20 something gay man. Like, you can't skip the section on sexual health because you didn't feel like you're comfortable talking about it. So it's not just people outside the medical community, but people inside it too have to deal with whatever shame, stigma, fear that they have around talking about sex with their patients, because it's their responsibility. I tell my medical providers a lot that a patient might be intimidated, like there might be some shame, stigma, fear when they go in the room, but they're going to feel as scared as that provider is. If that provider comes in and says, hey, you know what? I'm really excited to talk about the stuff with you today, then patients will more often than not, like, really, wow, I actually have an opportunity to have all these questions, like, oh, what lube should I be using? Oh, what condoms would be a better fit for me? Or like, what can I do to make this thing safer? I'm really, this is a lot of fun, but I'm scared about X, Y, Z. Is this safe? Is this not safe? Safe too is kind of a judgmental word, but like, what can I do to make this as safe as possible? Or what should I be concerned with when I'm doing this, so that I and my partner plus partners can have as much fun without having to worry. Yeah, that was a roundabout question, but I think I wanted to take ownership for the medical community too, because it's certainly our responsibility to talk to our people that are that are out there too. But for people that are just, yeah, no, I think overall just having open, honest conversations and saying that, and sharing that you should be able to have a conversation with your medical provider and your whatever nursing staff that they have, and that should be okay. So if you have that conversation and it doesn't go well, that's on them. You did the right thing by bringing it up. I'm really afraid that people, like, I encourage people to go out and do that, but when they go and they have a bad experience, they feel like, oh, maybe I shouldn't have said that. I made a mistake as the patient. I'm leaving feeling ashamed. And you know what? If you're in that experience, it's their fault. They fucked up, not you.
You know, you made me come back. I had one teacher in my entire academic high, junior, elementary school, junior high, one teacher, and it was my sixth grade gifted teacher. And we talked about sex because one of the guys in the class thought vagina was vagina.
And
Yeah, vagina. So,
that teacher gave you kind of an open,
but
honest
that was the
conversation.
only time that we
Yeah.
ever engaged to even know how to say vagina. You know what I'm saying?
What
Like,
grade?
that's not a conversation. I can't name another year of my school year, pre college, that we talked about sex. When I was in health education, it was taught by a coach, and we did nothing. We did nothing. We sat in class and talked to each other every day, every day. And then I think he had to have, like, finals and things. So they came up with these random tests, but gave you all the answers to the test so you could just pass. It was ridiculous.
That's a
Ben,
great
I'm
point.
going to bring you to this point of the conversation where I ask everyone the same question. And this question is there anything that you feel in the community that we are not shedding any light on or not enough light on?
Hmm, that's a big question. I think we've done a lot of good work in the last 5 or so years. We've really been catching up. Um, I think we're not shedding enough light on. I think we've done a lot of good work on HIV stigma. I think there's a lot of work to go on from there. But I'm seeing, I think we're seeing a lot of growth and improvement talking about and tackling HIV stigma. I think I've seen a lot of growth and improvement. Still a lot of more work to go about supporting our trans family in the kink and leather community. I think I've seen a lot of growth, but there's still a lot of work to do with making sure that women feel supported in the kink and leather community. Um, I get disappointed when I see my female identifying leather family excluded from spaces because cis men don't feel comfortable around them in sexual settings. I think I'm disappointed when I see that. I think we can do better to make kink and leather spaces accessible and make everyone make our full community feel welcome in those spaces. Um, but overall, I feel hopeful, and I think we've seen a lot of growth, and I think we pushed each other to do better. Um, but I think still sometimes I see that there are places where people still want to see um, only people that look like them. I think we have to and I get some of where that comes from to say, you know what, I can feel comfortable around people that look like me, and a lot of times in our community, it's like, oh, we're not allowed to be me somewhere else. So this place where people look like me, I feel comfortable in. And I get how that is a first step.
Yeah.
But I think we can get beyond that to a space where uh, kinky, leather, and BDSM people can support the community as a whole in sexualized spaces that we can feel safe in.
So basically, no kink shaming.
Not just kink shaming, not being afraid, not feeling that we only need to make spaces for people that look like us.
Yeah. Mhm.
You can be community by not with it's about
Put people
why
that
someone is
first.
there, not because what that person is physically bringing there.
Yeah. Yeah. I 100% agree with you. Yeah. Yeah. All right, Ben. Well, that brings us to the end of this episode of Throwing Light. Thank you for coming over here. This is what I call the holiday Christmas episode. So,
Didn't show you any of my books. Your LTJ
well,
read.
yeah, well,
I
go
brought you all
ahead.
my books,
Do
man.
that. Let's talk about it. Go
All
ahead.
right. Shout out to Real Service. This is one of my favorite books. Anyone doing DS play, MS play, like this is my favorite book. It really talks about building partnerships in an MS and BS, a DS relationship. Real Service by a good called Dara. Great book. We did this one too, negotiating power dynamic relationships. Leather Folk. If you haven't read this one, it's a classic.
Yeah.
Leather Stacks is also really good. Leather and BSM Handbook, classic. And again, for any MSDS, Ask the Man That Owns Him is a great one too. But I know you're a reader, so I wanted to bring some of my favorites to you.
Yes. I have leather folk. I know for sure that's great. I've been reading a lot on leather and spirituality. I need to submit a class to this year's Austin Kink Weekend or next year's 2025. I think I'm gonna do leather and spirituality. That's what I think I want to do. So look for that. I think that's a big aspect of my life that I feel like I'm hiding just because people confuse religious and spirituality. You know what I'm
Sure.
saying? Like, I'm not religious, but I am a spiritual person, and I don't want to deny that part of myself. And the leather community shouldn't want me to deny that part of myself. So that's how I feel about that. All right, Ben. So that brings us to the end now. I'm so glad you were on the show. I was really excited because I was like, what's going on? And so this was so informative. There was so much knowledge in this. I appreciate it so much. It was so great because I don't think we've had a good sexual health conversation. And thank you for tying that to the leather community. Thank you for being you. I think you're one of those, what I call, let me put it like this. I tell you, in this day's age, I'm not inspired by politicians and I'm not inspired by celebrities in Hollywood. But people like you, everyday people that we encounter, I do think you're somebody that inspires people. And that's why you were a judge for Austin Kink Weekend. So I appreciate you for showing up as a leather person all the time and being your authentic self.
Well, thank you. It means a lot to hear you say that. I appreciate it.
For sure. All right, y'all. Well, that brings us to the end of Throwing Light. And if you're not throwing light, you're not acting right. Goodbye, y'all. Thank you, Ben.